Hi, I'm Sheila Renner. I'm a medical technologist at Huron Regional Medical Center. I have been a medical technologist for 32 years, 30 years here at HRMC. We are such a diverse group of people, I think, that work in the lab. When I first originally started, I was going into pharmacy, which is a little bit different than lab, and I found that I didn't get the challenge with pharmacy that I did with the laboratory. So I did switch and ended up in medical technology, which I love. A lot of people like to talk to me about what I do because I do love it so much. There's a lot of different ways to get into lab. There's 2 years and 4-year degrees, and I recommend the 4-year degree because you can get more into your management and supervisory positions by having that 4-year degree. Plus it also makes you more of a well-rounded employee when you start out in the field. I like the lab. There's a lot of different ways to work in lab. There's reference labs, hospitals, clinics, and there's now research labs and even manufacturing that are requiring the skill set that lab professionals bring. We have a turkey plant close to our town, and one of the things they have to check is make sure that their turkey products are not contaminated, and so they use a lab professional to do the cultures and stuff to make sure that there isn't contamination and the food supply is safe that they are putting out. I guess I love the hospital setting because I like knowing that I don't know what my day's gonna bring. And maybe that sounds crazy to some people. One day I can walk in, there's a car accident in the emergency room, and we're all scrambling to save lives there. It could be an OB that has some sort of emergency and has to go to surgery for an emergency C-section. It can be a chemo patient that needs to have blood products given to them because their body is having a difficult time with the medication they're receiving. Or even just a little kid who's just born and their kidneys or liver isn't functioning quite right, so we have to check their bilirubin to make sure that that's not getting too high and toxic. So I hope that what you find in the lab, I can't stress that enough, I guess, what I do. So I hope you find what you love to do, but please think of the lab when you're looking at the different careers